Hi everyone, I am Shirley Cesario and I will be discussing about the Philippine Patient Bill of Rights. Number 1. The patient has the right to considerate and respectful care. Number 2. The patient has the right to and is encouraged to obtain physicians and other direct caregivers relevant, current, and understandable information concerning diagnosis, treatment, and prognosis. Except in emergencies, when the patient lacks decision-making capacity and the need for treatment is urgent, the patient is entitled to the opportunity to discuss and request information related to the specific procedures and or treatments, the crisis involved, the possible length of recuperation, and the medically reasonable alternatives and their accompanying risk and benefits. The patient has the right to know the identity of the physicians, nurses, and others involved in his or her care, as well as when those involved are students, residents, or trainees. The patient also has the right to know the immediate and long-term financial implications of treatment choices insofar as they are known. Number 3. The patient has the right to make decisions about the plan of care prior to and during the course of treatment and to refuse a recommended treatment or plan of care to the extent permitted by law and hospital policy, and to be informed of the medical consequences of this action. In case of such refusal, the patient is entitled to other appropriate care and services the hospital provides or transferred to another hospital. The hospital should notify patients of any policy that might affect patient choice within the institution. Number 4. The patient has the right to have an advance directive concerning treatment or designating a surrogate decision maker with the expectation that the hospital will honor the intent of the directive to the extent permitted by law and hospital policy. Healthcare institutions must advise patients of their rights under the state law and hospital policy to make informed medical choices as if the patient has an advance directive and include that information in patient records. The patient has the right to timely information about hospital policy that may limit its ability to implement fully and legally valid advance directive. Number 5. The patient has the right to every consideration of his privacy, discussion, consultation, examination, and treatment should be conducted so as to protect each patient's privacy. The patient has the right to expect that all communications and records pertaining to his or her care should be treated as confidential by the hospital, except in case such as suspected public health hazards where reporting is permitted or required by law. The patient has the right to expect that the hospital will emphasize the confidentiality of this information when it releases it to any other parties entitled to review information in these records. Number 7. The patient has the right to review the records pertaining to his or her medical care and to have the information explained or interpreted as necessary except when restricted by law. Number 8. The patient has the right to expect that, within its capacity and policies, a hospital will make reasonable response to the request of a patient for appropriate and medically indicated care and services. The hospital must provide evaluation, service, and or referral as indicated by the urgency of the case. When medically appropriate and legally permissible, or when a patient has so requested, a patient may be transferred to another facility. The institution to which the patient is to be transferred must first have accepted the patient for transfer. The patient must also have the benefit of complete information and explanation concerning the need for rest, benefits, and alternatives to such as a transfer. Number 9. The patient has the right to ask and be informed of the existence of business relationships among the hospitals, educational institutions, and other healthcare providers or players that may influence the patient's treatment and care. Number 10. The patient has the right to consent to or decline to participate in proposed research studies or human experimentation affecting his care and treatment or requiring direct patient involvement, and to have those studies fully explained prior to consent. A patient who declines to participate in research or experimentation is entitled to the most effective care that the hospital can otherwise provide. 11. The patient has the right to expect reasonable continuity of care when appropriate and to be informed by physicians and other caregivers available and realistic patient care options when hospital care is no longer appropriate. Number 12. The patient has the right to be informed of hospital policies and practices that relate to patient care, treatment, and responsibilities. The patient has the right to be informed of available resources for resolving disputes, grievances, and conflicts, such as ethics committees, patient representatives, or other mechanisms available in the institution. The patient has the right to be informed of the hospital's charges for services and available payment methods. Okay, thank you so much for watching, and those are the Philippine Patient Bill of Rights. Bye-bye!